Welcome to Nursing Prep. Push yourself in nursing preparation with Smart Way. Practice this quiz on www.thestudyblog.com. Health promotion and maintenance. The public health nurse who does blood pressure screening and related health education is conducting activities in the level of Option A. Primary prevention. Option B. Secondary prevention. Option C. Tertiary prevention. Option D. Focused prevention. Right answer is Option B. Secondary prevention. The health educator who teaches proper body mechanics for bending and lifting is conducting activities in the level of Option A. Primary prevention. Option B. Secondary prevention. Option C. Tertiary prevention. Option D. Focused prevention. Right answer is Option A. Primary prevention. The clinic nurse who refers a client with multiple sclerosis to a support group and provides information about community resources for counseling is conducting activities in the level of Option A. Primary prevention. Option B. Secondary prevention. Option C. Tertiary prevention. Option D. Focused prevention. Right answer is Option C. Tertiary prevention. A home health nurse who provides skincare and repositioning of a client on bed rest is conducting activities in Option A. Health promotion. Option B. Health protection. Option C. Health prevention. Option D. Rehabilitation. Right answer is Option B. Health protection. A 22-year-old male client wants to start an exercise program, but he says he doesn't have the time or money to attend a fitness club. The nurse recognizes the behavior-specific cognitions and affect variable of Option A. Perceived self-efficacy. Option B. Perceived barriers to action. Option C. Interpersonal influences. Option D. Situational influences. Right answer is Option B. Perceived barriers to action. Which of the following statements reflect the pre-contemplation stage of the behavior change model? Option A. I stopped using butter on my sandwiches to help lower my cholesterol. Option B. I think I will join a fitness club next month because exercise is going to reduce my risk of having a heart attack. Option C. I don't think I can change my cholesterol levels with my diet. High cholesterol runs in my family. Option D. I don't worry about my cholesterol anymore. It has been controlled well with a low-fat diet and exercise plan for 6 months. Right answer is Option B. I think I will join a fitness club next month because exercise is going to reduce my risk of having a heart attack. Which of the following statements reflect the maintenance stage of the behavior change model? Option A. I am learning more about low-fat substitutions, and am trying them with my favorite recipes. Option B. I quit my diet a few weeks ago, and I plan to start it again after the holidays. Option C. I need to eat lots of fatty foods because I have a high metabolism. Option D. I make low-fat choices when I eat at home, but it is a little more difficult to find low-fat meals when I dine out. Right answer is Option D. I make low-fat choices when I eat at home, but it is a little more difficult to find low-fat meals when I dine out. The nurse educator planning a smoking cessation program understands that the most basic type of health promotion program is Option A. Utilizing a variety of media for information dissemination. Option B. Conducting health risk surveys. Option C. Providing counseling for lifestyle and behavior change. Option D. Facilitating environmental control programs. Right answer is Option A. Utilizing a variety of media for information dissemination. Information and discussion about child health and safety issues are appropriate for health fairs, including locations at Option A. Clinics. Option B. Schools. Option C. Churches. Option D. All of the above. Right answer is Option D. All of the above. The health educator offering weight control and exercise programs is an example of Option A. Information dissemination. Option B. Health risk appraisal and wellness assessment. Option C. Lifestyle and behavior change. Option D. Environmental control program. Right answer is Option C. Lifestyle and behavior change. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.